Hi, my name is Erin Darby, and I will be presenting on measles. Measles is a virus that lives in the nose and throat. It's transmitted through droplets from coughing and sneezing. The virus can live outside the body for up to 2 hours on surfaces exposed to these droplets. The incubation period for the virus is 10 to 12 days. During that time, the infected individual has no symptoms, but the virus is replicating in the respiratory tract, eyes, and lymph nodes. Humans are the only known reservoir for measles, and it cannot be transmitted through any other animal vector. No asymptomatic carrier state has been documented for the measles virus. It's so contagious that 90% of people without immunity will develop symptoms. 14 days after exposure, the individual will develop a fever, cough, runny nose, and conjunctivitis with possible loss of appetite, diarrhea, and lymphadenopathy. 2 to 3 days after the symptoms begin, the individual will develop Koplik spots. These are white lesions found in the mouth. 3 to 5 days after symptoms begin, the individual will develop a rash of small red bumps. It starts at the top of the scalp and spreads downward, covering the whole body, including the hands and feet. The rash and fever typically subside after a few days, but the person is contagious from about 4 days before the rash develops to about 4 days after it fades. Complications from measles are most common in children under 5 and adults over 20. About 1 in 10 children will get an ear infection, which can result in permanent hearing loss in severe cases. 1 in 20 children get pneumonia and require hospitalization. This is the most common cause of death from the measles in young children. Diarrhea from the measles can cause dehydration, and measles is a common cause of blindness in developing countries, typically due to underlying vitamin A deficiencies. 1 in 1,000 children develop encephalitis, or swelling of the brain, which can leave the child deaf or with intellectual disabilities. Measles can cause miscarriage or preterm birth and low birth weight in pregnant women, and 1 to 2 children out of 1,000 will die from the measles. Anyone who has not been vaccinated or already developed measles immunity is at risk of contracting the disease, especially young children and pregnant women. It's common in developing countries, especially in parts of Africa and Asia, and can be particularly devastating in countries recovering from natural disasters or conflict. In sub-Saharan Africa, the fatality rate is as high as 5 to 10%, while in developed countries the rate is fewer than 1 in 1,000. In the year 2000, 58% of measles deaths occurred in sub-Saharan Africa. Before an effective vaccine was developed in 1963, nearly all children in the U.S. got measles by the time they were 15 years old. About 3 to 4 million people in the U.S. were infected each year, and 400 to 500 of those died. 48,000 were hospitalized, and 4,000 suffered encephalitis from the measles. According to the World Health Organization, while global measles deaths have decreased by 78% in recent years, measles is still common in many developing countries. More than 20 million people are affected by measles each year, and the overwhelming majority of deaths occur in countries with low per capita income and weak health infrastructures. In the year 2008, there were 140 cases reported in the U.S., and in this past year, nearly 700 cases were reported in the U.S. About 74% of those were linked to an outbreak from Disneyland in California, and most of the children affected by the measles in that outbreak were not immunized. The map here shows measles outbreaks between the years 2008 and 2015. The majority of the cases are found in sub-Saharan Africa and Southeast Asia, including the Philippines. Doctors can typically diagnose measles based on its signature rash. They must report suspected cases to their local health department within 24 hours. Laboratory confirmation should be done for all sporadic cases and outbreaks to determine the origin of the virus. There's no antiviral treatment for measles other than the management of its symptoms. Good nutrition, fever reducers, adequate fluid intake, and treatment of dehydration is recommended to replace fluids and other essential elements that are lost through diarrhea or vomiting. Antibiotics should be prescribed to treat secondary eye and ear infections as well as pneumonia. and children in developing countries diagnosed with measles should receive 2 doses of vitamin A supplements given 24 hours apart. This treatment restores the low vitamin A levels during measles and can help prevent eye damage and blindness. Vitamin A supplements have been shown to reduce the number of deaths from measles by 50%. If an individual is exposed to measles and has no evidence of immunity, they should receive the MMR vaccine within 72 hours, which may provide some protection or reduce symptoms of the disease. The global public health strategy for fighting the measles centers largely on mass immunization campaigns worldwide. A single dose of the vaccine is 93% effective at preventing the disease and 97% effective after 2 doses. Through a combination of programs over the last decade, vaccinations have resulted in a 78% drop in measles deaths worldwide. Still, measles is an epidemic in many developing countries, and 95% of deaths from measles occur where there is poverty and weak health systems. The vaccine was first developed in 1968 and is the most effective prevention method. It's typically administered at 12 to 15 months, followed by a second dose at 4 to 6 years. In 2013, about 84% of the world's children received 1 dose of measles vaccine by their first birthday through routine health services, which is up from 73% in the year 2000. 2 doses of the vaccine are recommended to ensure immunity and prevent outbreaks because 15% of vaccinated children will fail to develop immunity from the first dose. Measles vaccination resulted in a 78% drop in measles deaths between 2000 and 2013 worldwide. This map shows the immunization rate in infants around the world. In blue countries, 90% of infants have been immunized, while red countries in sub-Saharan Africa show that fewer than 50% of infants have received the measles vaccine. There are a number of organizations around the world fighting to eliminate measles. The Measles and Rubella Initiative is a partnership between the American Red Cross, World Health Organization, UNICEF, Centers for Disease Control, and the United Nations Foundation. Since 2001, the Measles and Rubella Initiative has supported 80 countries to deliver more than 1.1 billion doses of the measles vaccine, and the partnership has invested more than $950 million in measles control activities. In 2013, Doctors Without Borders treated nearly 130,000 people for measles and vaccinated over 2 million people in response to outbreaks. Other organizations, like the Bill and Melinda Gates Foundation and the Lions Club, raise and provide funds to improve access to vaccines worldwide.